Good afternoon, everyone. Thank you for joining us this afternoon for Public Policy 101, the National Disability Institute. I welcome you all, and again, I thank you for coming on and listening to us. My name is Katie Metz. I am the Manager of Financial Empowerment Inclusion with the National Disability Institute. With that, I'm going to turn it over to my colleague, Nakia Matthews, so she can give you a few housekeeping tips and technical assistance review. Nakia?
Thank you, Katie, and good afternoon, everyone. The audio for today's webinar is being broadcast through your computer. Please make sure that your speakers are turned on or your headphones are plugged in. You can control the audio broadcast via the audio broadcast panel, which you see an image of here on this slide. And if you accidentally close this panel, you can reopen it by going to the Communicate menu at the top of your screen and choosing Join Audio Broadcast. If you do not have sound capabilities on your computer, or if you prefer to listen by phone, you can dial the toll or toll-free number that you see here and enter the meeting code. Please note that you do not need to enter an attendee ID. Real-time captioning is provided during this webinar. To access the captions, click the Media Viewer button in the upper right corner of the webinar platform. For Mac users, the Media Viewer panel will be automatically open in the lower right-hand corner of your webinar screen. If you would like to make the Media Viewer panel larger, you can do so by minimizing some of the other panels like chat or Q&A. And conversely, if you do not need the captions, you can go ahead and close the Media Viewer panel. We will have time for questions at the end of the presentation today. Please use the Q&A box or the chat box to send any questions that you may have during the course of the webinar to either me or Katie Metz, and we will direct those questions to our speaker. If you are listening to the webinar by phone and not logged into the web portion, you may also ask questions by emailing them directly to Katie at kmetz, K-M-E-T-Z, @ndi-inc.org. Please note that this webinar is being recorded and that the materials will be placed on the NDI website. If you experience any technical difficulty during the webinar, please use the chat box to send me a message, or you may email me directly at nmatthews@ndi-inc.org. And with that, I'll turn it back over to Katie. Katie, are you there?
Yes, thank you, Nakia. Thank you again to all of you for joining us today. So for those of you who may not be familiar with National Disability Institute, we are a national research and development organization with the mission to promote income preservation and asset development for persons with disabilities so that we hope to build a better economic future for Americans with disabilities in the future. And we thank you for joining us today to learn more about how we can achieve that together. NDI's Real Economic Impact Network is an alliance of organizations and individuals such as yourself who are dedicated to advancing the economic empowerment of persons with disabilities. If you're not already part of the REI network, we encourage you to join the more than 4,500 members who are located throughout the United States, including nonprofits, community tax coalitions, financial education initiatives, corporations, private sector businesses, federal, state, local governments, and individuals themselves or individual family members who have disabilities. All of these partners join together to embrace, promote, and pursue access to inclusion of persons with disabilities in the economic mainstream. Again, if you found us by different means and aren't part of our REI network, we encourage you to join or learn more information at realeconomicimpact.org/REI-network. With that, I would like to introduce my colleague, Christopher Rodriguez. Chris is the Senior Public Policy Advisor for National Disability Institute, and he has extensive experience working on behalf of individuals with disabilities both on the state and on the national levels. Prior to joining NDI, he represented Michigan Protection Advocacy Service Incorporated as Director of Governmental Affairs and Media Relations. He also worked for UCP National, the National Association of Councils for Developmental Disabilities, and the ARC of Texas. Mr. Rodriguez also is the younger brother to an individual with intellectual and developmental disabilities. So with that, I turn it over to you, Chris. Are you there? I think we're just having a moment of difficulty. There we go. Chris, are you there?
Hey, Katie, this is Nikia. I'm going to run in there, everyone, and try to get Chris set up. Give me 1 second.
No problem.
Now we can hear you, Chris.
I can hear you now. Oh, great.
All right, I apologize about that. I think I was on mute there and didn't realize it. But I certainly appreciate the opportunity to talk today about some of the issues affecting people with disabilities that focuses on financial stability and mobility and some of the things surrounding employment and economic self-sufficiency of people with disabilities and some of the things that are going on here at NDI and on the federal and state levels. So let's go ahead and begin. So our agenda today, we're going to talk about what is public policy. Well, then we're going to talk about two of the more substantial pieces of federal policy that are currently being implemented that affect people with disabilities and their financial stability and mobility. And then we're going to talk about a couple initiatives on the state level, that being the ABLE Act and various financial literacy legislation that's going on in state legislatures. So, what is public policy? Public policy are practices used by government, local, state, and federal to help direct rules, programs, and laws affecting the public or segments of the public. So this can range from anything from the local level to the state level. Typically you're going to see a lot of things dealing with the state legislatures, with the state agencies and things like that. A lot of the important programs for people with disabilities are actually run on the state level. A lot of the things that provide vocational rehabilitative services, a lot of the different specific special education and general education provisions are run on the state level. But then we have public policy that is clearly made on the federal level. You're going to see a lot of the entitlement, Social Security type things that are specifically run on the federal level, and then a lot of the overarching things behind both rehab and education and various bills, pieces of legislation and laws that affect people with disabilities that have been established on the federal level and then subsequently implemented on the state level. So, moving forward. First I want to talk about the Workforce Innovation and Opportunity Act. President Obama signed the Workforce Innovation and Opportunity Act, or WIOA, into law on July 22nd of 2014. WIOA is designed to help job seekers, including those with disabilities, including those with youth with disabilities, and including people with the most significant disabilities, access employment, education, training, and support services to succeed in the labor market, and to match employers with the skilled workers they need to compete in the global economy. Congress passed the act by a wide bipartisan majority, and it is the first legislative reform in 15 years of the public workforce system. So, what are some of the key components specific to people with disabilities? So one, WIOA increases funds for transition services for youth with disabilities. It limits the use of sub-minimum wage for youth with disabilities. It helps integrate communication between state agencies related to education and various employment services such as vocational rehabilitative services. And it provides important vocational-related definitions that have never been included in previous laws, such as what is supported employment. Moving forward. So, home and community-based services rules. So the final home and community-based services regulations set forth new requirements for several Medicaid authorities under which states may provide home and community-based long-term supports and services. The regulations enhance the quality of HCBS and provide additional protections to individuals that receive services under the Medicaid authorities. So basically, individuals with disabilities across the country take advantage of what are called HCBS Medicaid waivers, or Home and Community-Based Services waivers. Originally, these were created to help individuals with disabilities leave institutional type settings, so the big brick and mortar residential settings that are, for the most part, things of the past, and move into the community, which is why they got their name, Home and Community-Based Services. Now, in the past, people struggled to figure out what the definition of home and community-based exactly is. Before, it was basically anything that was not the giant brick and mortar institutions. However, as time went forward, we realized that a lot of the things that were being justified for using money that were considered home and community-based weren't things that the disability community thought were truly in integrated settings. So recently, CMS came out with new rules and new definitions under what these home and community-based services Medicaid waiver dollars can be used for. Now they're giving states a 5-year period. I'm going to fast forward here. So the key components allow states, basically give states the ability to submit a 5-year transition plan explaining how they will transition individuals into more community-based integrated settings. So this is going to affect individuals that are taking advantage of these HCBS waivers in both aspects of their residential lives and aspects of non-residential settings. So that's where it comes into play. These are going to be trying to get individuals out of segregated work environments and into integrated competitive employment opportunities, allowing them to start moving forward with their financial stability and mobility, and allowing them to kind of move up the economic ladder. Again, states have 5 years to figure out how to transition those individuals from less integrative settings to more integrative settings. They've had to submit a 5-year transition plan to CMS, which is the Center for Medicaid and Medicare Services, and those have to be approved, and those are going to be monitored over the next 5 years to make sure that states are using those funds, which are the HCBS waiver Medicaid dollars, in an appropriate manner to provide for services in the most integrated setting for people with disabilities. So, moving forward. So now we're moving on to some initiatives that we're trying to tackle on the state level. So recently we came across some financial literacy legislation that was filed in the state of Florida, which would create with state funds a program to enhance financial literacy for people with developmental disabilities. So this is a key component. As as we look at the last two pieces of public policy, both WIOA and with the new HCBS rules, everything's moving in the direction of helping people with disabilities obtain integrated competitive employment at a level that they never have before. So one of the incredibly important aspects about allowing people or giving people the opportunity to earn money is to help them understand how to manage that money. So that includes things such as benefits management, of course, how to save for the future, how to understand credit, and how to protect yourself against financial predators. So this is interesting. This is kind of what this bill was trying to do. Unfortunately, this bill ended up dying. It was passed by the Senate, but unfortunately wasn't able to be passed on the House side prior to the session ending. But it still provides for excellent language that we're going to begin using to try and implement different similar programs across the country. And we're going to do this by going to each individual state and trying to educate their policymakers, specifically their state legislators, on the importance of these financial literacy education, specifically for people with disabilities. So, moving forward. This brings us to, I think, what we're going to concentrate the majority of our time on here today, and that's the Achieving a Better Life Experience Act, or the ABLE Act. So we're going to go over some of the basics on the federal level, and then we're going to talk a little bit about what's going on at the state level, and then hopefully what some of you can do to help influence and help hasten the development of these vital programs for people with disabilities. So, first off, the Stephen Beck Jr. Achieving a Better Life Experience Act became law in December 19th of 2014. Basically what this does is it creates a new option for some people with disabilities and their families to save for the future, while at the same time protecting their eligibility for federally funded public benefits. So what is an ABLE account? ABLE accounts are established in the new Section 529A Qualified ABLE programs. 529 accounts are qualified savings accounts that receive preferred federal tax treatment. ABLE accounts enable eligible individuals to save for disability-related expenses, and we're going to go talk about what that means here in a little bit. ABLE accounts also are not yet available, and there are still some unknowns about how this program will be implemented. Assets in and distributed for qualified disability expenses will be disregarded or given special treatment in determining eligibility for most federal means-tested benefits. So basically what this is saying is this is going to allow people with disabilities to have what is basically a special savings account where they can put money in, and that money will not be included when determining eligibility for means-tested federally funded benefits such as Social Security and Medicaid. Now there's all kinds of stipulations that we'll go over in regulations that cover these accounts, but by and large that's basically the purpose. What are some important requirements of ABLE accounts? So each individual may have only one ABLE account. So an individual, unlike say a college savings plan where you can have multiple savings accounts, this is different. And a qualified individual with a disability is only allowed to have a single ABLE account. Designated beneficiary is the account owner, so that means that the person with the disability actually owns the account themselves. They are the designated beneficiary and they are the account owner. An account must be established in the designated beneficiary state of residence or in a contracting state. The total annual contributions made should not exceed the federal tax limit, which is currently $14,000. So what this means is anybody has the ability to contribute into an ABLE account, but total in any given tax year currently, that amount of money contributed aggregately or total cannot exceed $14,000 in a single year. So that means if you have two contributors, each one donating $7,000, then that would cap the contributions for the year. So in total, only $14,000 can be contributed to the account total by any and all contributors, not individually. Okay, so multiple individuals may make contributions to a single ABLE account, as we just discussed, and aggregate contributions may not exceed the state limit for a typical 529 savings account. So a typical 529 savings account, if anybody on the webinar is not familiar, are what are called college tax-deferred college savings accounts. And what, with respect to this provision, when I say aggregate contributions may not exceed the state limit, every state has a limit to how much money can be put in these accounts over an extended period of time. It's usually somewhere between $250,000 to $350,000. So that is, once a ABLE account hits that limit, no more contributions can be made to that account, period. All right, moving forward. So, who is eligible to be an ABLE account beneficiary? So there's two primary requirements in order to be considered a eligible beneficiary to establish an ABLE account. So number one, there's an age requirement. So the individual must have incurred their disability prior to their 26th birthday. So this doesn't mean that a person who, let's say, is 36 and has a significant disability can't take advantage of this. It just means that that person's disability had to occur before the age of 26. So another example, a person with Down syndrome who is currently 40 years old, of course Down syndrome occurs prior to the age of 26, would be eligible under this one particular criteria. Additionally, if a person, say, is 35 and they had a car accident that has left them with a significant disability, and that car accident occurred, let's say, when they were 22 years old, they too would meet this particular requirement. But if that same person had the same car accident after they turned 26, then they would not be qualified under this particular requirement to be able to establish an ABLE account. So, in addition to the age requirement, there's two other, you have to meet one of two other requirements. So either one, and this relates to the severity of the disability. So one, you have to have been determined to meet the disability requirements for supplemental security income or Social Security disability benefits. This is under the Social Security Act. Or you have to submit what is called a disability certification. This is going to have to include a physician's diagnosis that the individual meets criteria to be further established in regulations. It basically, it's essentially saying that you have the same severity of disability as is established through the Social Security level of disability, just perhaps without the SGA requirement. And we can get into that more specifics a little later. But with regard to the disability certificate, there's certainly more details that we're hoping will come out soon. The Department of Treasury has been obligated under the law to establish what are called regulations and rules. These regulations and rules stipulate kind of the guidelines on implementing any type of law, but for this case in particular, the ABLE Act, under which some of that clarification will have to do with what is a disability certification. So, moving forward. How do ABLE accounts assets impact eligibility for federal benefits? So, ABLE assets will be disregarded or receive favorable treatment when determining eligibility for most federal means-tested benefits. So, there is one exception, and this is for SSI. So, for SSI, only the first $100,000 in an ABLE account, only the first $100,000 assets will be disregarded. So SSI payments will be suspended, temporarily suspended, if the beneficiary's account balance exceeds $100,000. It is important to note that it will be suspended and not terminated, and that once the funds dip below the $100,000, they will then resume. In addition, housing expenses are intended to receive the same treatment as all housing costs paid by outside sources. So this basically means that SSI benefits are subject to a reduction of 1/3 the federal SSI payment as applicable. So moving forward. So it's important to differentiate the difference between the $100,000 limit with respect to SSI benefits and your Medicaid. So your Medicaid will not be touched regardless of how much money is in the ABLE account. So Medicaid benefits are not suspended if the ABLE account balance exceeds $100,000. With respect to Medicaid, it's also very important to understand that there is a Medicaid payback provision within the law. This basically states that any assets remaining in the ABLE account when a beneficiary passes away are subject to outstanding qualified disability expenses, will be used to reimburse the state of the beneficiary for Medicaid payments made on behalf of the beneficiary after the creation of the ABLE account. So basically what this is saying is that when a beneficiary passes away, However much money they have in the account that hasn't already been targeted for an expense, a disability-related expense, that for whatever reason has been purchased but not paid, the rest of the money in the account is to be used to pay back the state for all Medicaid related expenses that the individual incurred or took advantage of from the point in which they began the ABLE account. So this would, of course, once the money in the account is already expired, they're not going to go after any more money, but just to the extent that that exists. That's a very important aspect to understand of these programs. Let's see. For purposes of this section, the state is considered a creditor of the ABLE account and not a beneficiary. So that is significant as well, just saying that they will, they have to lay claim to that particular amount of money. Okay, so when will ABLE accounts be available? Now, this is a tricky question. Federal regulations need to be written. We discussed that previously. The Treasury Department is required to issue regulations or guidance within 6 months of enacting the ABLE Act. 6 months is within the next few weeks, so we are hopeful, although cautiously, that the Treasury will publish their regulations and guidance sometime within the next month, and certainly sometime before, hopefully before the end of the summer. And those are going to clear up a lot of the questions around some of the uncertainty with respect to the, specifically with respect to the disability certification and with respect to what they define as a disability-related expense. Because it's important to remember that the money that is building in these accounts can't be used for just anything. It has to be used for what's called a disability-related expense. And hopefully we expect Treasury to give some clarification on what those might be and what that looks like. In addition, before ABLE accounts become available, a state needs to pass authorizing legislation. So what this is what the federal law does is it allows states to establish these programs. It does not obligate a state to establish these programs. So in order for a state to move forward on this, each individual state has to pass through their state legislature their own ABLE legislation. This is can be tedious, however, just because of the vast benefits that come along with these accounts and the need for these accounts. In the last 5 months, we have already seen over half of the states adopt ABLE-related legislation to start implementing their programs. So we're hopeful to see the first ABLE accounts actually being opened, hopefully, in certain states sometime in early next year, in early 2016. In addition, each state must decide whether and how to offer a qualified ABLE program to its residents. Like I said previously, many states are considering legislation now. Many states, like I said, have already passed legislation. There is also the opportunity in the law if the state doesn't feel as though they have the resources or for whatever reason is uncomfortable with developing their own program, they do have the ability to contract with a state who is developing their program so that their residents can take advantage of the benefits of having an ABLE account, even though their state may not be actually implementing the ABLE program themselves. So all this adds up to the fact that the timing of ABLE programs to be available will vary from state to state. So, state legislation. Like I said, some states are moving quickly to pass authorizing legislation. Some are being a little more timid. Some are waiting for the rules and regs to come out, which hopefully will happen soon. But there are some minimum state requirements that we're recommending that exist in all state proposed pieces of legislation. So one, each state legislation needs to authorize a 529 ABLE program. This means that they need to basically mimic a lot of the language in the federal law that allows the program to exist. It needs to make sure that all the language is consistent with the federal laws and all the requirements are consistent with the federal law. that they don't have any conflicts that would render the state policies illegal. It also needs to designate a state agency to oversee the program. And a lot of states were going to find that the state agency will be the state treasurer's department, just because the state treasurer's department is already overseeing the savings accounts related to college tuition, which the ABLE Act will look, or the ABLE accounts will look very similar to those accounts in many respects. In addition, the state legislation needs to exempt the funds in the ABLE account from state means-tested programs. On the federal level, the funds are exempt from federally funded programs, but unfortunately the federal government does not have the authority to exempt them from state-funded programs that might support people with disabilities. So we're finding a lot of states are doing that. We're recommending that there should be exemption of ABLE accounts from state taxes. So what this means is that if a state has state income tax, that contributions made to an ABLE account could have some kind of tax advantage, such as being allowed to be tax deductible. We think that would encourage people to contribute to these accounts. And the authority to contract with other states. So this gives a state that has decided to move forward on building an ABLE account the ability to offer that program to a state who is interested, but like I said before, is not moving forward on developing their own program. Another requirement that we've started to recommend to states but is not included on this list is to include a financial literacy component within the state legislation. So this kind of pairs into what I had mentioned previously with the Florida legislation. It'd be great to see, in addition to these requirements, states building financial literacy program geared towards people with disabilities, so that when they are savings and when they are beginning to save substantial amounts of money in these accounts, they understand what that means, what they can be used for, how to set goals for savings, and how to spend responsibly. Okay, so as a call to action, so I would be very much interested. I'm not completely aware of the kind of demographic or geographic locations of people on the webinar, but I'm sure some of your states have either passed ABLE legislation or have filed ABLE legislation. I certainly ask that the folks on the call figure out what's going on in your state with respect to ABLE. What steps are they on in the process of developing these programs? I also encourage everybody to figure out ways on how you can assist the development of a program and who can help you accomplish these goals. So looking at these questions, some of the things that I've recommended to people who have called me from various states wanting to be more involved in this is see what's going on with your state disability advocacy organizations. There's certain organizations that help folks with disabilities that are going to exist in every state by law. So the developmental disabilities councils are going to exist in every state. The protection and advocacy system is going to exist in every state. Your university centers on disability are going to exist in every state. I think every state has a state ARC chapter that exists. UCP, United Cerebral Palsy, has a significant presence in the states. On the federal level, some of the groups that we've been working very closely with that I know have a significant reach in their communities on both the state and local level are Autism Speaks and the National Down Syndrome Society, and both of them, excuse me, have significant affiliates on the ground that I encourage people to reach out to and get more information on what's going on with your state specific to the ABLE Act. You're going to find that in some states legislation has not even been filed, although that's a very limited amount of states. And then I would encourage you to start contacting your state legislators, and informing them about the importance of having an ABLE Act and the importance of helping people with disabilities save for the future. In states that have already filed legislation, I would encourage you to figure out where that legislation is. So typically it's going to either be on the House side or the Senate side, and it's going to exist in a particular committee. When it's sitting there, if it's having trouble, I would encourage you to contact the chairman of that committee to educate them on the importance of passing ABLE legislation. For the states that have already passed ABLE legislation, I know that the entities responsible for developing the program are very interested in getting stakeholder input as they move forward on this, and that certainly includes, it should predominantly include the disability community, because these accounts are affecting people with disabilities. So I encourage you to be, there certainly is plenty of room to be involved in all aspects regardless of where your state stands in their development of these programs. So we've gone over a few of the public policy initiatives and things going on both on the federal and on the state level, but I want to encourage everybody to sign up for our Washington Insider. This is a monthly public policy newsletter that NDI puts out, and it's sent out to the members of our REI network, among other individuals. If you're not a member, the link is here, and I encourage you to sign up. It's certainly going to give you very readily available information on what's going on the federal level with respect to public policy affecting people with disabilities, and specifically affecting policies that are in the realm of increasing financial stability and economic self-sufficiency. So I certainly encourage you all to sign up for that. And of course, I'm always available to answer any questions related to public policy. Here's my contact information there on the screen. I'd be more than happy to discuss. I know we went over a lot here, and WIOA, the Workforce Innovation Opportunity Act, is a 300-page bill with about 2,000 pages of regulations, proposed regulations, so there's a lot in there, and I of course didn't have time today to go through everything. Same thing with the HCBS waivers. There's a lot more there. The ABLE Act, it was just a very quick, fast explanation, but there's certainly a lot more to know, and I'd certainly be more than happy to go into those into more detail at a future time. If we don't get to everybody's questions, I'm always happy to do that. And there's going to be more information to come on all these programs. Or if you happen to live in a state that you think some of your contacts or state legislatures might be specifically interested in looking into programs for financial literacy for people with disabilities, please, I urge you to contact me so that we can get in contact with those folks and get the ball rolling. So I think right now we're going to move on to questions.
Great. Thank you so much, Chris. That's a lot of wonderful information, and I think on the heels of that, we have several questions here. So we'll get started. One individual wants to know, how can we determine the level of progress a state has made in making the ABLE accounts available? So I think that's probably a question for many individuals, and this individual specifically lives in Georgia.
Okay, I think that's a great question. So there's several different avenues that you can take to figure out where your state is. Certainly I would encourage you to contact your state disability advocacy organizations so you can be more involved, but I know that people may not necessarily have that kind of time. We include updates, monthly updates specific to ABLE in our Washington Insider. There's also, we're building what is going to be called the ABLE National Resource Center website, which will have up-to-date information both on what's going on the federal level and what's going on in each individual state. We're hoping to get that launched sometime this summer. In addition to that, right now, if you go to www.hcbs.gov, in as in Nancy, D, ss.org. That stands for National Down Syndrome Society.org. They have an up-to-date list of all the states and what's going on with their pieces of ABLE-related legislation. So I can certainly get that out to everybody as well.
Thanks, Chris. So having said that about the website, and one individual's question is, so this policy remains allows the IDD, Intellectual Developmental Disability Community, to create a protected savings account that doesn't affect their public benefits, but the guidelines for how to set up the actual accounts have not yet been set up. So that's the question. Also maybe clarify if this is only just for intellectual developmental disability members.
Right. So it is not just for individuals with intellectual and developmental disabilities. However, the way that the age requirement has been set up in the federal law, which is something we hope to in the future go back and change, it will predominantly, most likely, if in the future, if you did a survey of the beneficiaries, it would be my guess that the majority of them would have, so over 50%. Would be individuals with IDD. But as in my example earlier, let's say that you are 23 years old, do not have an intellectual and developmental disability, but unfortunately had a car accident which left you, quadriplegic with a significant disability. You would be, despite the fact that you do not have an intellectual developmental disability, you would be qualified in all likelihood for an ABLE account or for an ABLE program. So it is not exclusively for the benefit of people with intellectual and developmental disabilities. It's just that your disability had to occur before the age of 26.
Great, thanks, Chris. One other question. Can the ABLE account be transferred to another family member with a disability if someone is deceased and bypassed the Medicaid payback law?
Right. So we're looking for clarification on that, but let's say that let's say that you have two children. They are both meet the criteria for having an ABLE account. One unfortunately passes away. You would be able to roll over that account to the other sibling as long as they are a qualified disability beneficiary, yes.
Great. Going back to the HCBS, how does this, or does it affect group homes or clustered neighborhood housing that may be currently in effect for persons with disabilities?
That is a great question. So basically what the HCBS rules did, instead of giving a very clean definition of home and community-based, they kind of set up a list of characteristics that would describe what an integrated setting would look like. And they tried to compare it to the everyday life of anybody else that's just living in a typical residential setting. So this includes things like if I'm in some kind of group home, do I have the ability to eat when I want to, or am I being told that lunch is served from 12 to 1 and dinner is from 7 to 8, and if I'm not there at that time, then I don't eat? That is not going to be considered a home and community-based environment. Going towards things that we deal with, it includes making sure that individuals have a strong capacity to oversee their own finances or the proper supports to do that. Does a person have the ability to do those things? So it's hard. These things really need to be looked at on a case-by-case basis. But some of the things that people are talking about, do I have the ability to lock my room? Do I have the ability to invite friends over when I want to have friends over? Let me try. Do I have access to the community the way anybody else would have access to the community? Or am I allowed to only go out to certain places and in a group setting? See, those things are not going to cut it. And it's not to say that people won't be allowed to live in those types of places. It's just that those individuals will not be able to utilize home and community-based dollars to live in places like that. And it's not only applicable to residential settings, but it's applicable to non-residential settings, such as day hab programs and sheltered workshops. So it's a very complicated transition, which is why CMS has given states 5 years to do it. In addition, they have to submit, like I said, a 5-year plan, in which that plan is supposed to include where each state is in respect to individuals being integrated into the new home and community-based services. But by and large, the more progressive disability organizations and community advocacy community certainly, I would think, do not believe that these things such as the farms and the gated communities and things like that would not meet the new criteria, excuse me, of the latest rules.
Thanks, Chris. And so we have another question that kind of can segue into what we were just talking about, and it's back to the ABLE Act, but the individual is asking, if the person with a disability is not able to make prudent financial decisions, so I would segue that is probably asking how is it determined that the individual is able to make prudent financial decisions? And then the question is, how can they be the owner of the account if they are unable to do so?
Right, that's a great question. So it has been, that was a big question over the last few months, and the IRS actually put out a notice reaffirming that the beneficiary is the account owner. What we're encouraging the Treasury to also include is that there is at least a presumption of competency. However, most of the state legislation is allowing there to be a signator for individuals who have guardianship, or for individuals who have other people taking responsibility over their fiduciary decisions. So while the individual would still be the account owner, there could be other people that have the authority to control the account, basically. And this brings back to why it's so important to couple these beneficiaries with significant financial literacy education, so that they can, to the best extent possible, learn how to manage the funds in that account in a responsible way.
Great, thank you, Chris. Another question: what is the difference between the ABLE Act and the TANF IDA account?
The TANF, that's a great question. I am not very familiar with the TANF account. I would suspect that, at least to some extent, the differences are the annual caps and the fact that the ABLE accounts have a restriction that they can only be, the funds in the accounts can only be used for disability-related expenses. I'm not sure what the money in the TANF accounts can be used for and what their tax advantages are. So.
That's okay. That kind of gives us another question that came up, which we know, as you mentioned, that the legislation doesn't specifically address what disability-related expenses will be, but is there any, has there been any talk of what they may consider disability-related expenses that might be allowable under the ABLE account?
Right, so we're arguing for the most liberal and wide definition of a qualified disability expenses. Currently, there is a list within the statute that talks about the categories. So basically, distributions from an ABLE account can be used for qualified disability expenses related to the individual's disability. They can include expenses related to education, housing, transportation, employment training and supports, assistive technology and personal support services, health prevention and wellness, financial management and administrative services. They can be used for legal fees, expenses for oversight and monitoring, funeral and burial expenses. And then in addition to all those buckets, they can also be used for expenses approved by the Secretary of Treasury under regulation. So we're hoping that in addition to those, which is actually a fairly broad group of categories that they can spend the funds on. We're hoping to expand that even further with the Secretary of the Treasury's regulations.
Great. So now that we kind of have an idea of what the expenses might be, there's a question as to how will individuals access the funds in their account? Will there be a limit on when the money has to be drawn down from the ABLE account, or will all of that be set by each state?
I think to a certain extent that's going to be set by a little bit by the regulations, but probably predominantly by the states, depending on the program. What we have encouraged the states and the Treasury to support is that the individual should have unlimited access to disbursements, that there shouldn't be something that says you can only pull money from the account for disability-related expenses twice a month. We think that would be extremely prohibitive. We don't want there to be any minimum contributions to start an account. We want it to be as easy as possible to get the money from the account to the provider of the qualified disability expenses possible. So.
Great. This individual lives in Mississippi and has cerebral palsy. What are ways that they can help MS Mississippi begin a literacy program? Which I think is good.
Right. I think that's a great question. I would begin with contacting your state legislator. You're going to have a state representative and a state senator, or maybe in Mississippi they're called assembly members and senators, and just start by the conversation of how important financial literacy is for people with disabilities. I think it's important to cite a lot of the trends going on currently that is moving towards helping people with disabilities establish employment, which ultimately is going to hopefully help them save money. And as people start to save money, I think it's important they understand how to manage that money. So that would certainly be my first move. And then, of course, like I said previously, always feel free to contact me. I'd be more than happy to, assist in those meetings with state legislators, to call in and offer whatever support I can, or some of the more specifics on what's going on the national level that would act to support financial literacy on the state level.
So I think we have time for just a couple more questions. One more. Given many individuals with disabilities receive other types of financial assistance, such as disability insurance policies, what efforts has NDI done to educate these policymakers to blend or hold harmless the insurance policy awards?
Right, so that's a very difficult thing to do. So I think an ABLE account, an ABLE account is another avenue to put your money. Of course, they're going to be, I don't think they should be in direct conflict with each other, but I think they're part of the toolkit to help funnel those types of monies. In addition to an ABLE account, there's always special needs trusts and pooled trusts where you can put the money to make sure that it isn't interfering with your eligibility for means-tested federal benefits. I don't know that I've never heard of insurance policies, at least the payouts of insurance policies, being disregarded because it is just cash, basically. But that's certainly something to think about.
Probably our last two before we wrap up, which kind of go together. First, how do I find the limit for 529 savings account in my state? And if my state doesn't pass legislation for the ABLE Act, what are my options for advocating to do so?
Right. So typically you can Google 529 in your state, and you'll get the state state cap. Like I said, it's going to be somewhere in between 250,000 and probably 350,000. I think is the max, the other max. As far as if your state has not filed legislation, I would start connecting with your state disability-related organizations. That's going to be your ARCs your developmental disabilities councils, your UCPs, your protection and advocacy organizations. These are all organizations that have offices here in Washington, and I know that their offices in Washington are telling them and giving them information and encouraging them to create strategies to introduce state legislation. So I would pair with them. Hopefully they have all the information that I have and that other organizations have, that you can start to organize and then start to disperse and educate your state representatives and senators, because ultimately they will be the ones that have to pass the legislation. In addition to that, if you're a state where if you're living in a state where the government is less inclined to develop programs, I would encourage them to contract with other states. I know that there's several states that are hoping to contract with states that are not as comfortable building a program, such as Virginia, Florida, and I understand Colorado might be states that are willing to administer other states' programs. And then again, like I said, always feel free to contact me, and I can put you in touch with some state-level folks so that you can kind of get the ball rolling.
So one real quick follow-up to that might be helpful as well, Chris, is they asked if you can provide any links to the comments that NDI submitted to the Treasury Department about the ABLE Act.
I can certainly do that. Yes, I can get that out to the REI network very soon. Awesome.
Thank you so much, Chris. You had such great information, and as you mentioned, I know that you'll continue to update us all through both the REI network and, of course, the Washington Insider. And I encourage all of you that, again, may have found us through other means. If you're not already part of the Real Economic Impact Network, please go ahead and sign up. It's very simple to do. You go to the bit.ly link that we have located on the PowerPoint, NDI Sign Me Up, and we will make sure that you are added to our network to receive notices on legislation that may be pending, advocacy issues, webinars such as the one today, and access to our entire staff of experts who really want to work with you to ensure economic empowerment, self-sufficiency for Americans with disabilities. We will have another webinar next month, Wednesday, July 8th, at 3 p.m. Eastern Standard Time. For more information about that webinar, it will be sent out through REI Network and on our website, realeconomicimpact.org. So please check that out. You can also check out today's archived webinar recording PowerPoint on our website, realeconomicimpact.org. And again, we encourage you, as Chris said, reach out to him or any of our staff if you have additional questions or want more information on how you can advocate for the ABLE Act in your own state. So once again, thank you, Chris, for joining us today and sharing the wealth of knowledge that you have around public policy in general and for the advocacy that you're doing for individuals with disabilities. With that, I wish you all a good afternoon and contact us with any additional questions. Thank you so much.